Hi everyone, I'm Abdul Jazieh. I'm the editor-in-chief of the Global Journal on Quality and Safety in Healthcare and chairman of the Oncology Department at King Saud bin Abdulaziz University for Health Sciences, Riyadh, Saudi Arabia. It is my pleasure in this short video to present to you an overview on our editorial that was published in the third issue of 2020 Global Journal on Quality and Safety in Healthcare. You see there the citation as well as the DOI, and it addresses managing healthcare workers during COVID-19 pandemic and beyond. As you know, COVID-19 pandemic has impacted healthcare systems in a major way, resulting in interruption of care and exposing patients to harm. And of course, healthcare workers are also at risk to getting exposed to harms from infection, from stress, exhaustion, and burnout. So this manuscript actually shares ideas um, and suggestions, recommendations on how to manage staff during this crisis and other crises. The editorial suggested 3 questions to be asked to help manage the staff during the crisis. And of course, each question has sub-questions under it to help you systematically manage your staff. The first question is, are staff protected from risks posed by the crisis? Means, are they equipped by reliable and up-to-date knowledge pertaining to the disease, route of transmission, and so on? So do they have the adequate knowledge? Then do they have the personal protective equipment they require to protect themselves and be able to manage their patients? And are there strict precautions implemented that prevent their exposure to the risk, whether from their patients or from other co-workers? So that's the first question. The second question, are the staff able to do best job possible? Do they have a clear planned approach on what is expected of them? What do they need to do? If there's clear communication plans and channels between different entities, especially between the leaders and the staff, and vice versa. And do they have all the resources they need, not just the personal protective equipment I just mentioned earlier, but also do they have the medications, other medical equipments, materials, and so on that help them provide good jobs so they don't get frustrated from not having the ability to provide the best care for their patients. The third important question is, are the staff supported to maintain their own well-being? So if there is an effective mental health support program for healthcare workers, whether it's in person, whether it's online, by phone, whether it's virtual, and so on, there should be programs that support your staff. And then, are there mechanisms that help healthcare workers overcome the challenges they are facing from day to day? So they should be able to know where to seek help. So these are 3 important questions should be asked and answered in structured way with their sub questions that are entailed in each of the questions. Now, the article provide actually table that has multiple actions that are recommended for each of these questions to be answered in a practical way and provide the readers certain practical tips on how to address any issues related to these questions. So you will see in this slide and the subsequent slides the list in that table, and you can find this in the article itself. So this is another slide showing the answer to the second question. What are the actions you could do to address that question? And this slide showing the answer in terms of action that you can do to answer the third questions about supporting staff to maintain their own well-being. So the take-home message here, there are many of many recommendations provided here and in other sources that help you manage the staff and help the staff take care of themselves also, because there are many things here are falling on the individual person. It's an individual responsibility that people has to take care of it, take care of it in order to protect themselves and enable them to take good care of their patients and maintain the good work environment that help patients and safe for the staff to take care of their work. Thank you very much. Appreciate you reading the article and looking forward for any comments from you. Thank you all.